Here are 10 Puerto Rico Medical Board-style clinical vignettes focused on pharmacokinetics, pharmacodynamics, and drug metabolism, each with 4 multiple-choice options and detailed explanations to enhance your understanding. Vignette 1. First-pass metabolism. A 55-year-old man with hypertension is prescribed a new oral medication. Despite adherence, his blood pressure remains elevated. The physician suspects extensive first-pass metabolism. Which organ is primarily responsible for this effect? A. Kidneys. B. Liver. C. Lungs, stomach. Answer: liver. Explanation: first-pass metabolism refers to the initial processing of orally administered drugs by the liver before reaching systemic circulation, which can significantly reduce drug bioavailability. Vignette 2. Zero-order kinetics. A patient overdoses on a drug eliminated by zero-order kinetics. Which characteristic applies to this elimination process? A. Constant fraction eliminated per unit time. B. Half-life remains constant. C. Rate of elimination is independent of drug concentration. D. Exponential decrease in plasma concentration. Answer: rate of elimination is independent of drug concentration. Explanation: in zero-order kinetics, a constant amount of drug is eliminated per unit time, regardless of concentration, due to saturation of metabolic pathways. Vignette 3. Volume of distribution. A 70-kilogram patient receives 500 milligrams of a drug intravenously. Plasma concentration measured shortly after is 10 milligrams per liter. What is the approximate volume of distribution, VD? A. 5L, B. 25D, D. 75L. Answer: B. 25L. Explanation: VD equals dose T2. Plasma concentration equals 500 milligrams per 10 milligrams per liter equals 50 liter. However, since the drug distributes in total body water, which is approximately 42 liters in a 70 kilograms person, the closest option is 50 liter. Vignette 4. Cytochrome P450 induction. A patient on warfarin starts a new medication that induces cytochrome P450 enzymes. What is the expected effect on warfarin? A. Increased anticoagulant effect. B. Decreased anticoagulant effect. C. No change. D. Increased risk of bleeding. Answer: B. Decreased anticoagulant effect. Explanation: induction of cytochrome P450 enzymes enhances the metabolism of warfarin, reducing its plasma concentration and anticoagulant efficacy. Vignette 5. Half-life calculation. A drug has a half-life of 4 hours. Approximately what percentage remains after 8 hours? A. 25%, B. 50%, C. 12.5%, D. 75%. Answer: A. 25%. Explanation: after one half-life, 4 hours, 50% remains. After two half-lives, 8 hours, 25% remains. Vignette 6. Renal clearance. A drug is primarily excreted unchanged in the urine. In a patient with renal impairment, what adjustment is most appropriate? A. Increased dose. B. Decreased dose. C. No change. D. Shortened dosing interval. Answer: B. Decreased dose. Explanation: reduced renal function impairs drug excretion, necessitating dose reduction to prevent accumulation and toxicity. NASH Vignette 7. Therapeutic index. Which statement best describes a drug with a narrow therapeutic index? A. Wide margin between effective and toxic doses. B. Safe for over-the-counter use. C. Requires close monitoring of plasma levels. D. Low potency. Answer: C. Requires close monitoring of plasma levels. Explanation: a narrow therapeutic index indicates a small range between therapeutic and toxic doses, necessitating careful monitoring to ensure safety. Vignette 8. Competitive antagonism. A patient overdoses on a benzodiazepine. Flumazenil is administered as an antidote. What type of pharmacodynamic interaction is this? A. Non-competitive antagonism. B. Competitive antagonism. C. Synergism. D. Allosteric modulation. Answer: B. Competitive antagonism. Explanation: flumazenil competitively inhibits benzodiazepines at the GABA receptor, reversing their effects. Vignette 9. Drug potency versus efficacy. Two analgesics are compared. Drug A provides pain relief at 5 milligrams, while drug B requires 50 milligrams for the same effect. Which statement is accurate? A. Drug A is more efficacious than drug B. B. Drug B is more potent than drug A. C. Drug A is more potent than drug B. D. Drugs A and B have equal potency. Answer: C. Drug A is more potent than drug B. Explanation: potency refers to the dose required to achieve a given effect. Drug A requires a lower dose, indicating higher potency. Vignette 10. Bioavailability. A patient is switched from intravenous to oral formulation of a medication. The oral form has 50% bioavailability. If the IV dose was 100 milligrams, what should the oral dose be to maintain equivalent plasma levels? A. 50 milligrams, 100 milligrams C, 150 milligrams. D. 200 milligrams. Answer: D. 200 milligramation. To achieve the same plasma concentration with 50% bioavailability, the oral dose should be doubled. 100 milligrams IV, 1.5 equals 200 milligrams oral. These